Okay, I think we can start. Good morning, good afternoon, good evening to everyone who's joining the session. My name is Batsi Majuru from the World Health Organization. And before we get into the session, I just want to thank our sponsors, P&G, Children's Safe Drinking Water Program, and also apologize for the typo that you see on the slide. So it's thank you to our sponsors. Unfortunately, we couldn't edit that before the session. Next slide, please. So I'm joined today by my colleagues, Rick Johnston and Knox Coleman, for the session on strengthening national capacities in water quality testing. And in terms of what we want to achieve today, we essentially want to share with you an overview of some work that we are initiating in strengthening mostly lab capacities for water quality testing, but also how we can strengthen field testing as well. So my colleague Knox is going to kick off the session with an overview of this lab strengthening initiative, talking about some of the efforts that we've engaged in to date, some of the findings that we're seeing from our assessments of lab capacities and future directions. And then he will also give an overview of a related piece of work, and that is around strengthening capacities for field testing of water quality, where we've been developing guidance on selecting field test kits. So we'll then conclude the session with just some highlights from WHO's evaluation of household or point of use water treatment technologies, where we'll be giving some highlights from round 3 of this evaluation scheme. So as you can see from the outline, these are all very much water quality related, but we'll spend the bulk of today's session on the first 2 of those areas. So strengthening lab capacities and also strengthening field capacities for water quality testing. And I'll also highlight that there will be opportunity to discuss, share your comments, pose questions at the end of each presentation. So I encourage you to post your questions or your comments in the Pathable platform that you're logged into. So with that, I will hand over to my colleague Knox to kick off the session.
Hi, everyone. Thanks for attending this lunch session, and I hope everyone's having a great conference so far. So as Batsi said, we wanted to talk a little bit about some of the lab strengthening efforts that WHO has been putting forth. So this has primarily been broken down into an immediate, intermediate, and long-term objectives. So this is really targeted at countries that are looking to increase water quality testing capacity at a regional, national, or local level. And so there's been efforts to do this in the past. And so WHO is by any means not trying to reinvent the wheel here. They're really trying to build on previous efforts that have taken place. So in the immediate term, they want to develop guidance in terms of materials and tools to address any of the capacity gaps that have been identified, some of which we'll talk about in the next few slides. So an example of this would be a question and answer fact sheet to aid in the determination of field kit test selection for water quality parameters. And then, as I said, collation of existing lab training capacity resources. So I know a lot of the attendees currently have groups that have resources that relate to lab training and different capacity issues. So we'd love to hear what those resources are, and there'll be a chance to contribute those. In the intermediate, we do want to take the additional resources, determine what they are, and then develop online training modules or packages to put these together and then to expand on them and address any gaps that exist and that are not currently being covered. We also want to stimulate continuous improvement of lab quality management systems and then promote national accreditations within these labs. And then in the long term, we want to take these training modules and gaps that have been identified and turn them into full courses. So a training course, so this could take place perhaps as a MOOC, which is an online learning platform. And then furthermore, we want to facilitate lab networking and communication, and then improve capacities between a mentor network. So connecting labs that are high performing and really have a lot of capabilities to measure parameters with those that are looking to expand on this. And then finally, also One of the issues that was certainly identified was procurement. So also finding resources that pertain to equipment and supply chains and procurement systems. So again, this is 4 countries that are seeking or training or resources to routinely sample and analyze drinking waters for compliance, and ideally those with a health-based standard. So some of the outputs of this effort are we surveyed common lab capacity strengthening needs, and then, as I said, build an inventory of existing training modules to address any of the gaps that have been identified, and then looking at these kind of supply chains and how to acquire funding or procurement of essential lab equipment that are needed in priority cases, and then develop selection guidance for water quality field kits. So this was also looking at supporting resources for the development of a national standards in relation to the small systems guidelines. And then, as I said, facilitating lab-to-lab communication and peer networking for continuous improvement amongst labs. So some of the efforts to date have been the following lab capacity assessments. So WHO supported the direct assessment of lab capacity in Bhutan, Indonesia, Philippines, and Vietnam. So this took place as a self-assessment questionnaire, and then there was in-country support from WHO representatives. There's lab-specific in-country discussions with personnel who are performing assays and running these labs, and then as well as a QIA water card assessment tool. Furthermore, WHO polled the regional offices to gather inputs and experiences related to capacity needs. And then we assembled an expert forum on capacity gaps with collaborators from WHO collaborating centers, NGOs, and further researchers. So what are the findings from the capacity gaps assessments? So here are some of the gaps that are identified. So sampling plans, what to test for, why are we testing for it, where are we testing for it, maybe what frequency, sampling methods. So there's a lot of different methods that you can measure parameters for, the extensive literature that you can find, but in terms of evaluating, say, kits against each other, that's definitely an area of interest. Field test kit selection. So you have different methods. What's the pros and cons of each method? Are some of these available to use in the field, and some of these maybe are only in a lab environment? Really essential knowledge to know when you're doing water quality testing in the field, especially. What are your priority parameters? Is their source water being characterized? What are we looking at in terms of are these only the parameters from the small systems guidelines? Does your specific test water or source water have parameter needs that are outside of maybe common kits that are available or common lab practices? QA/QC practices, so use of controls, split samples, lab accreditation, interpretation of results. So are these results related to a drinking water quality standards? And then if they're over standard, that's a health-based standard, what's the implication for non-compliance? Capacity gaps within data management and reporting. How is the data being analyzed? And then when it's being presented or interpreted, who's the audience that it's going to? And is it being interpreted in such a way or being presented in such a way that it's clear for that audience? So say if it's a technical audience versus maybe a non-technical audience or management. And then using this data to make decisions based off of it. So what are the barriers and enablers to using data for continuous improvement? Another capacity gap that was identified was in sustainable training. So being able to have a system that withstands staff turnover. A lot of places reported that staff turnover was a very serious issue, and that replacing them could be very difficult, especially burdensome on existing staff who would have to perform training. And then securing reliable consumables and supply chains. So what are some of the next steps we're looking at? So WHO has requested training resources from their partners and then compiling a database of these existing training resources. A webinar has been developed for training lab personnel in water quality testing. And then, so we're going to request for feedback and schedule a date for that webinar. Identifying procurement needs of lab equipment through a lab capacity survey. and then also identifying WHO partners capable of providing drinking water quality lab training. So as I said, that'll happen in terms of developing online training modules. And then we're going to talk about field kits in the coming session, or the coming presentation after the discussion. So I'm really excited about that. For Rick to talk about discussion related to experiences of other lab strengthening efforts, and then key obstacles faced and how they're addressed.
Thanks, Colin. So some rich experiences there, and I'd like to open the floor now for anyone to raise your hands and comment either on what Knox shared, or if you have experiences of your own related to strengthening labs, to working with labs. We'd love to hear those.
Rick, if I may, while we're waiting for comments or questions to come in, I saw that Brian had posted a question in the Pathable platform as to whether these are just tests or sanitary surveys included. I'm not quite sure I understood the question properly, but just to highlight that what Knox has just presented on is really aimed at strengthening capacities, not just for testing itself with respect to how the assays are being done within the labs, but then also more importantly, looking at how the data from that testing is being used to inform and drive corrective action. So Knox briefly mentioned that this is work that essentially resulted from some of the work that we're doing now in updating our guidelines for small community water supplies, and recognizing that there are a lot of gaps, especially with labs that are located in remote or rural areas, and trying to think about how we can drive some capacity improvement amongst those labs and what that means for driving corrective action. So Brian, I hope that answers your question.
Okay, and I see we're getting a couple other comments coming through. Let me just read the last two that have just come in, the last few that have come in, and see if Knox or Betsy might want to react. Brian comments that his experience has been that there's a lack of initial staff quality, in terms of having people who've had some kind of university or college level training. So if there's something to say about human resources. Harnoor asks if there are resources or websites specifically around improving QA/QC guidelines in rural water quality labs. Knox, you had mentioned QA/QC as being one of the issues that came up. And then Brian also notes that people focus on the cost of the kits, but forget the cost of staff and travel. So both of those can be real bottlenecks. We know that sometimes labs don't have line items for procuring consumables, or especially if things need to be imported from out of the country. But yeah, just getting to the remote sites to implement the test has a cost, both in terms of human resource time and in vehicles. Knox, do you have any reactions to those comments based on your review?
So in terms of training costs associated and kind of staff costs, I think in transportation, that's certainly going to be a big issue, and something that we have initially included in our review for testing in the field. Because a lot of times, say, if you're going to walk in versus if you're going to drive in, or you have a four-wheeler or some kind of transportation, then that's a different type of test that you may be able to run, something that could be in a backpack versus something that could be in a cooler. So certainly those affiliated costs and tech costs, a lot of times those might be the most dominant factors as comparison to just the cost of purchasing the kit. And then Rick, could you remind me of the previous question before that?
Around human resources, so staff quality, getting trained people.
Yeah, so I think we're hoping that the online training modules could address this, but then perhaps be supplemented by either existing staff or NGOs that are working in the area that have expertise. Luckily, in terms of especially the microbial assays, they can be fairly simple to learn, which is great. And a lot of times they're set up as, the idea is to be as easy as possible to use, versus something, where you're doing maybe some of the advanced chemical parameters or metal parameters, which could be significantly more difficult and require more training.
Yeah, for sure. And Knox, we've got a couple of questions about quality assurance and control. So one was asking if there were any resources or websites that that you or Batsy had that we could recommend to people. And more generally, Samuel was saying that lab intercomparison is really important. There are a lot of different approaches to QA and QC. Are there any good practices that either of you want to shout out that can help strengthen the quality of work that labs do?
So in terms of resources, in terms of some of the great resource repositories that we have being, groups like COST and Acquia, and then of course, WHO platforms. In terms of directly addressing lab capacity field kits, it's something that we're interested in looking at. And Batsy, do you know any off the top of your head that any specific resources that are available? I'm not sure if I can list one off the top of my head, but
Oh, you're putting me on the spot here.
I don't think I can either.
Well,
but I will definitely, we can get back to you with some of those.
Okay, and just on laboratory intercomparison, I used to work at AOVAG, and they did do some interlaboratory round robin testing for chemicals. And the team in Switzerland would send out samples with known amounts of arsenic or other trace metals, and labs would then test those. They would all be blinded. There would be some replicates and blanks in there. And then the results would be shared with all of the participating labs, anonymized, but the lab would be able to see where their performance was. And that really helps to see, one, objectively, how good was their replicability and accuracy, but also two, how were they doing compared to peer institutions? Now that's much harder to do with microbiological testing because of, variability and having a standard value sent around. But that definitely is a valuable way. That's not all that expensive, though it is complicated to administer.
Yeah, if I can just come in on that. So I think one of the things that Knox mentioned in his presentation was that, and a very early step in this process was to speak to our collaborating centers, our partners, and just trying to understand what resources are out there, because the idea is not to create something new, but really to synthesize what is already out there and figure out what is best applicable depending on the needs. And so just last week, we had a call with one of the collaborating centers in Singapore who are interested in setting up that interlab comparison specifically for chemical reagents. And I think where the rubber hits the road sometimes is when it comes to, priorities, because this is really looking at the collaborating center that I'm referring to is really looking at such contaminants in mineral water. And yet we know that there are needs for, non-bottled water. So just regular testing for instance, arsenic in water supplies, and really trying to align those priorities with what is being offered by a particular entity. So I think it's fair to highlight that this is work that is somewhat in its infancy. And a big part of it will be us, trying to match resources or opportunities that are out there with what countries are actually expressing as needs as part of that process.
Thanks. Just keeping an eye on the chat. We have a couple more comments coming in here about training. Brian suggests that engaging with universities could be a way to have a more sustainable, process for training staff in a country. Samuel notes that reagents in developing countries, the quality of the reagents, and especially the storage conditions, if you don't necessarily have low humidity, low temperature storage, you can run into real difficulties there. So let me see what else. Samuel, you have all these comments. Samuel, do you want to unmute yourself and share some of these in person? Samuel Diarra from it's World Vision, right? Let's see.
Yes, are you getting me?
Yes, I hear you now, Samuel.
Yeah, thank you. I have worked with several labs in the past when I was working at the regional level and with many national office and even private labs. I've seen several times that they order reagent and they store it in a very difficult condition. Sometimes you can easily read that the reagent is for 1 year time or 6 months time, but after 2 to 3 months under the high temperature, the reagent will get spoiled. And then the result will not be accurate. The second thing I was mentioning right now in the chat box is strengthening policies about water quality testing. And these policies exist in many countries, but they are not reinforced. Many actors are not doing the water quality testing, or they do the testing for only major elements: calcium, magnesium, potassium, sodium, things like that, but they don't go deeper to look at sometimes fluoride, arsenic, and all the trace metals. So it is an issue, actually. If we want really these labs to be operational, we need the policy to be reinforced so that we will have quality results, we will have increased client for the lab, and then the lab will get resources, and the more they will get resources, they will get strengthened, they will get more equipment, and then finally, they will build more the capacity of their staff to meet the demand. Thank you.
Thanks so much, Samuel. Great points. We need to move on to the next session, but I did see that Brahma Apambire had raised a hand earlier. So Brahma, if you're still keen to share that, I'm asking you to unmute so we can hear your comment or question.
Yeah, Brahma, I work with the Desert Research Institute with a lot of previous experience with World Vision and worked with Samuel Jara, who just talked. I see that the survey is done in Latin America, or Asia. I don't know if the survey is also going to be done in Africa. That's number one. Number two, there's also an issue of in-country supplies. I know you are going to be talking about procurement, but the hacks and all that are not in-country. And sometimes we have to carry these supplies, even though they are very cheap, we have to carry them from the US or Europe to Africa. So are we also conducting survey around that to find out if we have the Fishers, the hacks, and all those companies in country? The third point that I wanted to make, which relates to what Samuel Jara already talked about, is the engagement of government in water quality testing. And I know WHO and most of us here know how critical it is. There are some times that the private sector in the country even has better analytical capabilities than the government, and it brings a little bit of tension. Working for World Vision, we helped to build a very big water quality laboratory in Ghana, which actually had better analytical capability than government. And there was a problem because the results come out of that, which are better than government, and sometimes it's an issue. And how is government engaged in these surveys that are done, especially government, regional laboratories, and central laboratories? Thank you.
Thank you, Brahma. Those are great points. And I appreciate especially the idea about working with government, even if there are, you build capacity for non-government labs, the government partners can still be involved in that and maybe participate in some kind of those inter-laboratory comparisons, for example. We need to move on to the next topic though. So I'm going to turn it back over to, I think it's Knox, who's going to take us through a discussion of selection of field test kits. Knox?
Thanks, Rick. So I think the discussion here really actually melds well right into the next talk, especially the points Rama and Samuel made about having the support of governments and funding to be able to continue to test And as Samuel highlighted, some of these can be very difficult if you're looking at some of the maybe less popular parameters or some of the trace metals or metalloids that maybe require a little more cost associated with them. So I think that links up very well with especially with the field kit selection talk. So this was brought up as an increasing request from countries for technical advice in the selection of field test kits for a variety of parameters. And this was recognizing that sampling needs differ between national and local levels. And also, between, as Brian pointed out, between NGOs and even government organizations. So this really highlights that the priority contaminants in some source and treated waters are going to differ between water providers, between regions, and maybe the needs of one. Say, if a source water is characterized with high arsenic, that needs to have continued monitoring versus one that doesn't. So that's very much to say that the use informs selection, and that really the consideration of the monitoring process is key. So sample collection, sample transportation. If you're in a rural setting that's far away from a testing lab, you're going to need to use a field test kit. Some of your samples might degrade or be invalid by the time you would able to transport it back to a lab, and then all the way through sample processing and preparation, and then data. So some of the considerations that have been identified for field test kit selection has been the use of field kits for compliance or regulatory monitoring, the reliability of parameters that can be measured, considerations for should a parameter be measured in the field or should it be measured in a lab, and then what are the costs associated with these field kits. So that's going to be deeply ingrained as well with procurement, meaning, as was pointed out, if Hawk or Lovabond or a large company maybe that is providing test kits in one region isn't able to provide test kits in another region. And then what other criteria may impact the choice of a field kit. So we start off by looking at some of the critical parameters that are outlined in small systems guidelines. And as Batsy said, this is very much in its infancy, so we're really seeking comment and recommendations from the audience. But we were looking at E. coli, thermotolerant coliforms, turbidity, chlorine residual, pH, arsenic, fluoride, lead, manganese, and nitrate, and then determining if the detection range and reliability considerations are valid. So could a field kit detect this within a health-based drinking water quality limit based on the parameter that may be specified in your country? And then applying this for regulatory or compliance monitoring. So is this kit qualitative, semi-quantitative, quantitative? Does it operate? Do you get a concentration out of it? Does it operate on a presence-absence principle? These are all important factors to consider when looking at whether a field kit would meet the qualifications for in-country use for regulatory or compliance monitoring. And then is there a national standard, and does this field kit meet that national standard? So some of the other considerations that are very important and have been highlighted in the previous discussion was looking at price range. So there's a cost benefit between the initial cost of, say, a kit that may be using a portable spectrophotometer or a probe chemistry device versus, say, a test kit that uses test strips. So there's going to be a cost per device, and you'll have to weigh the frequency of monitoring of that with the dollar that it costs per test. Portability. So how would your samplers be utilizing this kit? Would they be walking in with a backpack, motorcycle? Would it something that, do they have a vehicle that could fit a cooler? Because a lot of the kits, especially the kits that have been pre-assembled as a multi-parameter kit, can be quite large. They could fit into a medium-sized cooler versus some that might just, be transportable by backpack. And then procurement. Can you buy this kit? Are these companies dealing and able to ship to your region? And maybe is it something that you can get from a single source, all your parameters, or is this something where you have to pull in a bunch of different individual parameter kits and then assemble yourself into a total kit. And then the continual supply chain to acquire reagents and disposables. Another factor we're looking at is temperature. So especially for microbial parameters, does the test kit require an incubator, or could it do ambient temperature, or maybe a waste belt incubator? Those are going to be really important factors when looking for E. coli or thermotolerant coliforms. And then again, quality control and quality assurance. Has the kit been validated against a reference method? How has it been extensively tested, and does it meet a national standard that's relevant for your use? So some of these factors that are so important are being looked at by WHO in terms of the assessment of portable kits for E. coli testing. So Rick has a really great session coming up after this session in room 3 in the monitoring evaluation. And so there was an assessment of 20 portable kits for E. coli testing. And this is really exciting because they used both lab strain E. coli and wild type E. coli. And I'm a huge microbiology nerd, so I get really excited when I see studies that you're using both lab and wild type, because you can get some really interesting results when doing those kind of studies. And then they also looked at different incubation temperatures and durations, so answering some of the questions that we just talked about. So again, that's right after this session in room 3. So I know Rick and everyone would appreciate your attendance. So I'm going to turn it over to Botsy for questions and discussions over what key criteria should be considered when selecting a field test kit. And then Botsy is going to cover the Minty use code.
Thank you, Knox. Maybe before we go to our question to you on what key criteria should be considered when selecting these field test kits, I just want to give opportunity to the audience in case they have any need for clarification based on what you just presented. So again, you're welcome to type any questions that you have into the Pathable platform, but also see that the hand is raised. Abdul Basit, could you please unmute yourself and pose your question?
Yes, thank you very much. It was quite knowledgeable. Right, so thing is that I've worked in the developing world, and I'm also now working in the developed world. I mean, you know, it is good to see that there is field testing that we're talking about. But how about, you know, because I think that this is very good that you know that where the water is going and it is being tested at that particular place. But how about the main lines, you know, the supply lines and the distribution lines and some of the other infrastructures? So is it that there is any consideration going on that front as well, or it's just that we're talking about certain communities where it is going to be tested? And secondly, you know, we're talking about circular economy and plastics in general everywhere in the world. So, I mean, if we are able to get our assets on the utility side more cleaner, like in terms of water, I think there'll be a lot of plastics that will be saving, especially in the developing world. So, you know, I hope that they can take the first one, and even if they can answer on the second. Thank you very much.
Thanks for that question. Knox, do you want to respond? Or Rick? Yes,
yeah. So I think that, you know, a lot of the especially portability factor has been targeted towards, you know, areas that are a little further out that maybe don't have, that there's no opportunity to transport samples to a lab. But I think that's also not to say that kits could not be used by water treatment operators that are maybe testing throughout a city, or maybe with a lab that doesn't have the capability, a centralized lab that doesn't have the capability to run tests. So I think that it's I don't think we were excluding it, but a lot of the focus, you're right, has been primarily looking at testing in a field capacity where a lab is not available. And then I think your second question, was it related to the disposables that are associated with test kits, saying that there's packaging and waste products? I wasn't quite sure in terms of the plastic, or were you saying testing for plastics in water?
Yeah, so my point is, you know, that there is a lot of plastic bottles that are being used now. I've formed startup in London, which is primarily focusing on sustainability. So if you go around, you meet up the tech space or in general the startup space, there's a lot of talk going on where they say that for every bottle, you're using water, which is about 3 times that bottle, right? Now, so for example, all my life, majority of my life, I've lived in Pakistan. I've been to some of the other Southern Asian countries and more developing countries, and there's a lot of bottled water that is being used. Not to say that it is not being used in the developed world, but if we are trying to take care of some of the sustainability targets in the developed world now, so what we'll decide or we'll wait for maybe 5, 10 years or 15 years to go back to the developing world and then try and do things in there. So you understand what I'm trying to say. I'm saying that, if it is clean upfront or upstream, maybe whether it's our community or it's something, we will be getting rid of the water in that sense. So that was my query, that, if we are talking about those markets, it can be addressed maybe at the moment. I hope I'm clear. Thank you.
Absolutely. Yeah, I think that problems associated with plastic water bottle use and those kind of disposals has been, it's something that needs to be addressed, because and perhaps being able to provide clean water would reduce some of the need for consumable plastic bottles that are used.
If I can jump in on that, I think, yes, we would like for people to choose safe public supplies of water, but it is undeniable that there's heavy marketing, there's aspirational quality, so there will be people who choose bottled water or sachet water in some countries. And I think this question about strengthening national capacity for water quality testing, there needs to be strong surveillance of bottled water as well. And often the authorities who do water quality surveillance and testing for, say, piped water supplies don't have the mandate or sometimes the interest to do the same for bottled water. So you need to look at other partners who might be more involved in like food certification. But the same general principles apply, that there should be robust surveillance, there should be good QA/QC procedures, whether it's bottled water or water coming from more conventional sources.
Thanks for that. I also see some comments and questions coming in through the chat. So Luke Robertson says, are there field testing kits for enterococci in coastal areas? And is there any possibility of kits that can do source tracking? Rick, I know you've looked at a few test kits in preparation for this evaluation of E. coli field test kits. So if you have some insights on that.
Yeah, well, this relates to a general comment I have, that is that in the last 10 plus years, technological advances have made it easier to measure E. coli itself rather than thermotolerant coliforms, which is not only more specific, it's a better indicator of fecal contamination, but it ends up being faster and easier to test. Some of these media use, they're called chromogens, so they turn color or they fluoresce when particular bacteria produce an enzyme that's specific to that bacteria. So there are chromogenic and fluorogenic tests available for E. coli and also for enterococci and for other bacterial parameters. So I think the advantages of those media is that they give a very clear color signal, which should be specific to that bacteria. So you don't have to rely as heavily on chemicals or temperature to inhibit your non-target organisms. So it opens things up a lot, including for enterococci.
Thank you for those reflections, Rick. And I also see that a few people have already gone to our menti.com survey and are filling out their responses to the question on what key criteria should be considered when selecting a field test kit. So if you haven't already, I'd encourage you to go to that link, www.menti.com, and start filling in your responses to this question. I also saw a comment from Brian Reed with regards to these criteria that we're talking about. And he says that ease of use should not really be a consideration. Brian, do you want to elaborate on that?
Right, yes. Can you hear me? Just wave if you can hear me. Yeah, good. Right, there's been a drive to try and get really simple tests that anybody can use, But the critical thing is not getting a number out at the end of the day, but knowing what to do with that number. So there was a big push a few years ago by a university to get something that was really cheap, really quick. But what would you do with that number? And I think we've got to understand that the most critical element is the operator of these tests. So they're the people, they're your field staff, they're your staff that we're really designing these kits for. I hope that makes sense. I'm just rushing out of the house because I've got to go out this evening. Brilliant presentation so far. Best of luck with the rest of it.
Thanks, Brian. But coming back to what other people have said, accuracy is being highlighted as a very important consideration. User-friendliness, availability, temperature, sustainability, cost-effectiveness. Are there any thoughts or reactions to what Brian has just said with regards to ease of use and how that interfaces with the actual person who's doing the test? Okay, cost is coming up big again. If there are any comments that I've missed on the platform, I'm trying to multitask. Thomas Carter, if you could unmute yourself.
Hello, can you hear me?
Yes.
Yes.
My comment would be the reverse of the previous speaker in that ease of use and speed of results are ease of interpretation are the most important criteria. In our work, we have targeted the quick turnaround of some of the easier chromogenic assays, as Rick pointed out, is directly to the community members who are affected, and by the fact that they can for themselves see the results of the test, testing their own well, or testing their community's water supply or the surface water that they're collecting. Then if they're positive, and they often are positive for E. coli directly, then you have a very good opportunity to discuss methods of water purification, whether they're going to start using chlorine or boiling their water or whatever. But if you just have a kind of an abstract assay that's then sent away to some laboratory and they never hear the results of it, or somebody comes back and said, well, there's these unseen organisms in your water and you should do something about it, the motivation to change is very low. So I would say the direct assay that has a short turnaround time and which can be immediately discussed with the water users is probably the most important factor in my work anyway. So that would be my comment.
Thank you for those reflections, Thomas. And I think Rick can attest to the fact that, the time that it takes to interpret this has also come up as a consideration in some of the evaluation that he's doing of these E. coli field test kits. But I would say that a lot of these questions that we are posing, and in particular, these key criteria for consideration, are really dependent on the use case scenario, who's using those field test kits and for what purpose. And I think as part of this process of developing these, this guidance note, if you like, those are some of the situations that we are trying to balance, because I think ultimately the idea is to provide information that is useful so that somebody can be able to reasonably distinguish between a field kit that might not give you an accurate results. For instance, as I can see accuracy really highlighted on that Mentimeter, but also one that is affordable, one that is easy to use and suits the data requirements that you have, be it presence absence test or something that's more quantitative. So I would encourage you, if you still haven't participated in the survey, I would encourage you to just give us your opinions. We're really interested in this. And the idea is that we'll be able to post the summary of the criteria that people have voted for in that chat platform on Pathable. So with that, I will then close the session and then move on to the next part of the presentation. Okay, so I am going to be presenting on something that's somewhat different. We're still talking about water quality, but I'm going to be giving some highlights of results that we have seen from the third round of evaluations of household or point of use water treatment technologies that we've been running. So some of you who've been coming to UNC for a few years would know that we have an evaluation scheme. Next slide, please. That is aimed at evaluating the microbial performance of these water treatment technologies. And the primary objective is to make sure that there's an independent and consistent way of assessing their performance and thus be able to inform selection of these technologies. And the secondary objective is in strengthening national capacities in conducting complementary evaluations, but then also being able to regulate these household water treatment products. So in terms of how we work, it's WHO that is receiving expressions of interest, products to be evaluated from applicants, developing testing protocols, and also reviewing the results together with an independent advisory committee, and then also working with designated testing labs to conduct the testing. Next slide, please. So as I highlighted, this is really aimed at assessing microbial performance. So we are looking at 3 microbial groups: bacteria, viruses, and protozoa. And we have specified target log reductions that these technologies are required to meet. So we have performance that is classified in 3 tiers, where at a minimum, a technology should be able to remove 2 out of 3 of the microbial groups. So it could be bacteria and viruses, it could be bacteria and protozoa, but essentially being able to meet any one of those log reductions for 2 of the 3 microbial groups. So we call such a technology a one-star product, in that it is providing targeted protection for those 2 microbial groups that it is able to remove, for which it's able to meet the log reductions. In the middle tier, or in the 2-star tier, we have technologies that are removing a minimum of 2 log of bacteria and protozoa, and a minimum of 3 log of viruses. And then in the top tier, we have technologies that are removing 4 log of bacteria and protozoa and 5 log of viruses. So technologies that are in these 2 tiers, 2 or 3-star, would be classified as providing comprehensive protection in that they're able to remove microbes from all 3 classes. And if the product doesn't meet any of these performance tiers, then it's classified as providing little protection. Next slide, please. So in terms of the products that we evaluated in round 3, we had quite a range, but you can see from the list there that the majority of them were membrane filters. So we had 18 in total. We had a couple of UV devices, some flocculant disinfectants, and a chlorine dioxide disinfectant product. But again, the majority of these were membrane filters, so of different resolutions, so ranging from micro to ultra and nano filters. Next slide, please. This is just to give you an overview of the results that we have received from we've seen from these evaluations. We have results available for 16 of the 18 products currently. Results are pending for 2. But of those 16, essentially, we're seeing that the majority of them meet performance targets for 2 of the 3 microbial groups and are therefore classified as providing targeted protection. And this is, again, a range of technologies. So some of the membrane filters, ceramic filter, flocculant disinfectants, and UV devices. And then we also have some products that are meeting performance requirements for the 2 or the 3-star performance tiers that I mentioned. I should also highlight that as of this current round, again, this is round 3 of our evaluations. In previous rounds, we evaluated 10 products in round 1, 20 products in round 2. At that time, we had an evaluation process in which products were being evaluated once we had received the full complement of submissions. But in round 3, we moved to a rolling submission where we have an open contract with the designated testing labs. A product is submitted and it can immediately proceed to evaluation without us needing to have that administrative wait period. So that has allowed us as well to be publishing these results as and when they become available. So if you go to the WHO website and look for the HWT evaluation scheme, you will be able to see the specific product reports for the 16 products that I've mentioned, probably less than that because I think there are a few products that are pending upload, but essentially we're publishing these results as and when they become available. Next slide, please. So overall, from round 1 to round 3, we have evaluated a total of 48 products. And like I mentioned, the results for 2 are pending. But essentially, most of the products that we've evaluated so far are in that 1-star category, so providing that targeted protection. And there are a few more that are providing comprehensive protection, so removing all 3 microbial groups. I should highlight that there are some that fail. Unfortunately, I'm looking at the time, which is getting short now, but I would highlight that for those technologies that fail, there are very few of these technologies that are failing that we see failing because there's something inherently wrong in the product design. In most cases, is to do with inconsistency in the manufacturing. So for instance, we're seeing membranes for which, for instance, if you test 3 units of the same product, you could have 1 unit that's performing really well and 2 whose performance is really variable. So one of the main messages that we've been highlighting throughout this evaluation process is just that need for better quality management in the production of these products. Next slide, please. So in terms of impact and application of these results, one of the things that we really wanted to do when this evaluation scheme was set up was to have some list that people could go to and be able to compare how products perform. So highlighting that need for some harmonized criteria against which technologies have been evaluated, and use that as a basis to select those products. And so over the years, we've seen growing recognition of some of these products that have been evaluated under the scheme. A lot of the filters that were evaluated in between round 1 and 2 have been included in the product guide for UNICEF, was one of the major procurers of these technologies. And also we're seeing increasing recognition of some of these results by governments, where it's no longer just it's an outer filter and we expect it to perform well, but really questioning whether it does meet the performance requirements, and also seeing application of these results in settings that go beyond just the household level. Next slide, please. So I will just conclude by just highlighting that one of the areas that we feel that we really need to do more in is on strengthening national capacity. I mentioned that this was a complementary objective to the scheme, and I will confess that progress has been slow. I saw Anna Marie amongst the participant list, and she was one of the people who helped us in trying to develop regulatory criteria that we could be working with governments and implementing. And over the years, we feel that this is something that we need to be paying more attention to, more effort to, but recognizing that it does take a long time to be working on aspects such as regulation, such as strengthening capacity for water quality labs, because it goes beyond just capacity for testing household treatment devices. As capacities for routine surveillance, for instance, that we also need to be strengthening. So in future directions, next slide, please. That is something that we will be paying more attention to in terms of how we want to be setting ourselves up. So having WHO act as a resource to helping other labs develop or strengthen their capacity to be conducting local testing, but integrating that with other efforts that are aimed at strengthening water quality management as a whole. So relating to the presentation that Knox gave earlier. And round 4 is open, so we are accepting expressions of interest for round 4, and the email address is available on the website. Thank you.
Thanks, Betsy. It's exciting to see the results from round 3 and to hear that there will be a round 4. We've got about just under 5 minutes left for the whole session. So if anyone has a reaction or question about the scheme and household water treatment schemes, systems, raise your hand. Feel free to join the conversation. I think it's great to see that you can see those individual testing reports on the site of the scheme. We've put the link to that in the Pathable chat box, so I invite you to go there and see the results of the first 3 rounds. It was also nice to see the theme that quality management is really critical in the production of these technologies, and that links back to the discussion we were having in the last sessions about laboratory capacity strengthening and the importance of quality assurance and quality management. It doesn't come as a surprise that you need to have good QA, QC processes in place in both of these types of work.
Yeah, I would say that a lot of these issues are very similar, where they're talking about, household level water treatment or treatment on a larger scale. So I think that's really the thinking behind this capacity building initiative, where we're saying that instead of having capacity building that's just aimed at household water treatment, we're really trying to package it within wider capacity building efforts for water quality management as a whole, because the principles are essentially the same.
Good. Well, I didn't see any. Actually, there were a couple chats asking for resources or papers or reports about water quality issues and test kits and recommendations. So we've put a few in there, but we can provide some more. There is one question that's just come in, Betsy, about chemicals, and asking if there were some chemicals that gave little or no protection for bacteria, viruses, and protozoa. And then also from advice, a question about filters, if these are reusable filters or kind of use and dispose the materials. Any quick reactions to those?
Yes, sure. So a lot of the chemical disinfectants were in the targeted protection category, because, for instance, if we talk about chlorine, we know that it's not highly effective against protozoa. It would be effective against bacteria and viruses. So that's a typical example of a product that would be in the 1-star category. Having said that, we also had chemical disinfectants, also chlorine-based, that did not meet any of the performance categories and failed. And this is where I would also highlight that these QA, QC issues really impact on how a product performs. So it could be good chlorine, but if the QA, QC, the manufacturing process is not good, then you might see the product failing. And then on the filters, these are reusable filters. So some of them ceramic filters, some of them membrane filters that would be reusable over a long period of time.
Okay, thanks. And we're just in the final minutes now. So we've identified this importance of quality assurance, quality management as cross-cutting, really, through the whole session. And I think another theme that's come up repeatedly is that the purpose of collecting these assessments, doing this measurement, is to use the data for action. So whether it's having labs being able to interact with the service providers so that results are informing actions and leading to corrective actions, or whether it's specific household water testing products being found to be more or less suitable for different applications. You know, the point is to make use of all the information that comes from these detailed assessments. So I think with that, I'm going to close, and thanks, give big thanks to Colin and to Knox and to Betsy for the presentations, and also to everyone who's made some comments or shared their thoughts or participated in the chats. And we will be sharing, as Betsy mentioned, the results of that survey about criteria for field test kits. All right, thanks so much. Enjoy the rest of the workshop, and don't forget that this is all made possible because of our sponsors. So thank you, Procter & Gamble and the Children's Safe Drinking Water Program. And thanks, WHO. Thanks, Betsy.
Thank you, everyone.
Thank you.